So Denise Silver of Health 2.0 Europe asked about what would the likelihood of physicians being in a fee-for-service practice where they're paid more for the more patients they see, or in a salaried position, would they be more likely? I think the way I've seen, I've interacted with hundreds of physicians that do heavily use social media. I see there's one set of physicians who are part of a fee-for-service practice, many subspecialists, people who are in plastic surgery, orthopedics, different places where they really want to get their name out there as the world's premier doctor of this kind. They do want to set a personal brand because the more patients they see, the more they're able to earn. So that's one kind of physician. I think another kind of physician is an academic who would like to actually promote their research and to show that they have a lot of expertise in this and to share that expertise. And they see this engagement in social media as a way to ensure that their message is able to get out. I do see that providers who are in a salary position, oftentimes they have less need to promote their work because the larger group, say for example a Kaiser or a larger HMO, does enough promotional work to try and draw patients in to see them. And I see less of the employed physicians being interested in doing this other than doing it for personal reasons. And then there are physicians like myself who just have an intense personal interest in reaching out and being able to share these stories and being able to being involved in the community. And so I think there are extrovert physicians who are interested in doing a lot of volunteering and being involved in the community, and you'll see those kind of physicians richly engaging in social media.
You hear a lot, we're going to hear later on from Susanna Fox about, how the public wants the doctors as a patient, the patients want their doctors to be online, so to speak. Now, usually they never kind of parse that out in terms of what that means. But have you experienced a difference between, what I'm trying to get at is there a difference between what patients say they want and what they'll live with? Is there really a lot of undue pressure being put on physicians to think they need to be here, when in fact, what the patient really wants is just a doctor that communicates with them, regardless of the modality?
So the question is, what do patients really want? Do patients really want just a physician that can communicate with them regardless of the technology base, or do they really want doctors to be online? I see patients every day full time, so I can tell you that patients just want someone who's going to sit down, looking in the eye, and really listen and be willing to communicate. If that's using technology, great. If that's not using technology, that's fine, as long as I'm attending to your concerns. I've actually heard, understood, and responded to those concerns. I find that using technology makes that much easier. At my group, we have not only a private, secure, HIPAA-compliant website, a portal that allows them, but also they can be sitting in the grocery line. They can think, oh yeah, I wanted to ask my doctor about that. They can pull out their iPhone and shoot a message off to me using a secure app in a couple clicks. And that asynchronous connection, and my promise to them that I'd answer that message in a couple hours at least, makes a huge difference because they don't have to sit on the phone forever on a telephone line trying to click the right numbers to get to me and wait forever to talk to a nurse or leave that message. Technology can actually make these interactions much more efficient. And in that, I think patients feel much more attended to and more understood and better communicated with because I can respond to them on an ongoing basis. I can do it over and iterate. I can do it over and over and over because patients always have another question. The first thing patients do when they go home after they see me, they go online to Google, find out what the side effects could be before they ever pick up the drug. And if they are worried about something, they're going to shoot me a message and ask me about it before they start taking the medication. If Dr. Kim is in the back here. We just did a series of CME videos on medication adherence. If they don't have the reassurance that they are taking a drug that's not going to give them diarrhea and cramping, all terrible kind of things like with Levaquin, their Achilles tendon rupturing, they have lots of concerns that sometimes they don't address in the clinic because they don't know until they've Googled the medication or the treatment, and they have lots of questions. If I don't address those questions, they won't get on the medication and they won't actually complete the therapy and they won't get the relief, and they'll think that was a miserable doctor. And, even though I did my best to try and convince them in the clinic, in the office, that I attended to their concerns, I gave them the right medication. If they don't take it, then I'm in trouble. They're not going to get better. So these technologies actually make a big difference in being able to have patients complete and adhere to their medications. And I'd encourage you, if you're interested, cmecorner.com/ADHE is the website where we've done a number of videos on this using mobile, social media, these technologies to be able to improve medication adherence.
This slightly follows on from the question over there about the difference between doctors who are paid overtime and subsidised or not. And also your response to it detailing three different types of doctors. And the one that you didn't describe, but I'm sure the one that you believe in, is the doctor who's mainly concerned about patients getting the best possible treatment, even if the best possible treatment is no treatment. And I think one of the things that we can use social media for, we had a conversation at breakfast about this a bit, is to let people have more information about the pros and cons of treatment. And one of the things that we know is the more information you give people, the less likely they are to want any treatment at all. And I just wondered whether there's any movement in the States to perhaps translate guidelines and put them out on social media so that patients could see, well, okay, if I've got high blood pressure, I shouldn't start on antihypertensives until I've gone away with a 24-hour blood pressure monitor, and we make sure it's not white coat hypertension. And then, all of these adherence issues which you're raising are completely irrelevant, because we don't want people to be taking drugs that they shouldn't be taking.
So the question is, how can physicians engage in these public social media platforms to get the right public health messages out there so that patients who really don't need specific treatment for their illness, for example, the vast majority of folks with cough and cold come to me, and I have the darndest time convincing them that they're going to improve with time and some fluids and more rest, slowing down from their 18-hour days running around the office and working so hard. So I think that's really important. Part of what I've really been involved with is trying to get that message out that in these conditions where more of time and rest can improve things, I try to provide online guidance for, you're going to get better with these symptoms. And if you're not getting better, these are the kind of symptoms that you would have to worry about. If you have a prolonged fever, if you have terrible productive cough and really bad weakness, and you're getting worse and worse, and it's been maybe a week and a half, 2 weeks or longer. So I give guidance for, when to start to worry. Because people are all concerned about, you haven't given me any guidance, and if you can give guidance, if you can get the public health messages out there for these, when to actually seek care. I think those are really important messages to promote. And there are things that you can do really powerfully. For example, my work in the Palatal Mental Park Parents Club, this group of parents of kids under 5, they haven't gotten to school yet, so they're very involved with their preschoolers, and they really don't have a lot of outlet, but they're online like crazy. And so I've been really involved with trying to get the messages out to these in a private Yahoo group. The more you can get the message out there to people who are receptive and are willing to listen, the better.
Great. Well, thank you very much for that section.